Malek, and I'm moderating today's discussion. Before we introduce our guests, let me share with you a bit of background of In Search of Civility. This series is an innovative partnership between the Association of Idaho Cities, my law firm Smith and Malek, and the Boise Metro Chamber. We started this series in January and remain committed to discussing the challenges facing our state and country as we become increasingly polarized. We could not produce high-quality content without the support of our presenting sponsors, Dawson Taylor Coffee Roasters, Idaho Central Credit Union. Additionally, thanks to our sponsors, Power Engineers and Ørsted Architects. Their support is critical to expanding our ability to reach new audiences about civility issues in public discourse. Thank you to our media partners, Idaho Ed News, the Idaho Statesman, and the Idaho Press. They provide us with a platform and audience with whom we can interact. I'm joined today by my co-host, Diana Lacchiando, former Ada County Commissioner. Fitting for our topic today, Diana is also a former member of the Central District Health Board. Joining us today are two special guests, Ryan Sturm, a Central District Health Board member, and Boise County Commissioner, Dr. Ted Epperly, a former Southwest District Health Board member and President and CEO of Family Medicine Residency of Idaho. Welcome to our guests. And Diana, do you mind telling us a little bit more about them and how you got to know each of them?
Well, I'm happy to. And just to correct the record quickly, Dr. Epperly was on the Central District Board of Health with both Commissioner Sturm and I. And gentlemen, it's really nice to see both your smiling faces, although I do wish we were both meeting over a beer instead of online right now. So happy to introduce both of you. We'll start with you, Commissioner Sturm. Ryan Sturm was born in Weiser, Idaho, and is married with two bonus daughters and a daughter of his own. He joined the U.S. Army as a combat engineer, where he served for over 8 years before he was medically discharged. He served in Operation Enduring Freedom and 6 months in Kosovo. After the Army, he worked for the U.S. government as a private security contractor in Doha, Qatar. He moved back to Idaho in 2011, volunteering for the Weiser City Fire Department. He met his wife in 2013 and moved to Horseshoe Bend, working for the ACA call center as a security guard and then for DirecTV. He is a longtime volunteer firefighter for Horseshoe Bend Fire, and after receiving his EMT license, Horseshoe Bend Ambulance. In 2017, he was elected to the Horseshoe Bend City Council. 1 year later, he applied for a vacant Boise County Commissioner seat and was appointed, which included the role of board member for the Central District Board of Health. He plans to run again in 2022 for the election of Boise County Commissioner. Dr. Epperly is the president and CEO of the Family Medicine Residency of Idaho, a large federally qualified teaching health center comprised of 9 FQHC clinics, 4 family medicine residency programs, and 5 fellowships. Dr. Epperly retired in July 2001 as colonel after serving 21 years in the United States Army. He is the past president and board chair of the American Academy of Family Physicians and a past board member at ACGME, the entity responsible for all residency and fellowship training for over 125,000 residents and fellows of all specialties in the United States. He currently serves as the co-chairman of the board for the Healthcare Transformation Council of Idaho that is in charge of helping transform healthcare for the state of Idaho. Dr. Epperly is the graduate medical education coordinator for the state of Idaho and the author of the state of Idaho's 10-year GME plan to build a vibrant and robust GME system for Idaho. He has published over 50 articles and book chapters, and he is a staunch supporter of family medicine education research in both rural and underserved areas. He's the author of the award-winning book, Fractured, America's Broken Healthcare System and What Must Be Done to Heal. So thank you, gentlemen, both so much for joining us today. What we didn't include in there, of course, was you both survived the last year and a half sitting on a health board. So congrats for that. All right, go ahead, Luke.
Well, again, thank you both for being with us today. This is a topic that we think is going to be really important to our viewers because health boards really played a big role throughout COVID. And let's start by talking a little bit about the role of Idaho's health districts and the regional boards. So Commissioner Sturm, let's start with you.
All right. So really at the end of the day, the responsibility for the health board is, and the health district is to kind of get everything together at one time, figure everything out, and get all your information together, and then disseminate it to the 4 or how many ever counties that you encompass. Central District Health happens to encompass 7 counties, or 4 counties, sorry. So we disseminate that information for those 4 counties, and then we make decisions based on the information that we're given. And so it's a very large joint effort between us and medical professionals and providers, and then of course any other individuals that would play a role in that, whether it be epidemiologists or whether it be school board personnel, commissioners, counties, cities, and then we kind of get all that information together, and then we approach the issue and the problem, kind of get it figured out.
Great, thank you very much, Commissioner. And Dr. Epperly, what about your perspective on that? Anything you'd like to add?
Yeah, I would, Luke. Thank you. I see the role of Central District Health falling into 3 categories. The first is oversight. So it's both a governance and a policy setting board. And part of its oversight function is to the community's health, to the public health of our 4 county area, as Ryan said, as well as providing oversight to the Central District Health employees and director, Russ Duke. The second of 3 functions it has is program development. We work as an oversight body to help give advice to Central District Health in terms of program development. It could be in women, infant, and children programs. It could be in reproductive health. It could be with diet and exercise programs. It could be with tobacco cessation and tackling the opioid problem in our 4 county area. The third role I see for Central District Health is in the arena of education. So we help the staff and Director Duke in regards to helping provide oversight to educational opportunities that can help enhance the public health. So those would be the 3 things: oversight, program development, and education, that I would add to what Ryan had to say.
Diana, did you have a question?
Sorry, I'm of course just getting myself unmuted. Well, I really appreciate you both sharing that, because I think for so many members in the community, maybe this past year and a half was the first time they really even heard about the health districts. They weren't necessarily paying attention, and those of us who are on the board, we're more used to working on issues around septic tanks and the infant safe sleep campaign, and we're really just been thrust into the crux of the pandemic. So to that end, the pandemic changed so much for all of us, but particularly for those of us serving in local government roles. So I'd like you to tell us a bit about how you approach decision making during COVID-19. And Commissioner Sturm, would you like to get started?
Sure, Diana. So for me, it was really hard because I got, as I've told you before, and Dr. Epperly knows, I fell into politics, right? And so I didn't grow up and planning on a career in politics. And so it was a big jump for me coming into the whole situation. And then of course, a pandemic, right? And who would ever guess that I would have been part of, helping take care of the response to a pandemic. And so that was a big role for me personally, a big step for me, trying to figure that out and trying to do right by my constituents at the same time as I was trying to do right by the information that I was being given by medical professionals and by other board members, and we were all sharing the same information and trying to share information with each other that maybe someone else didn't have. It was really kind of hard for me personally, because I was kind of stuck in between a rock and a hard place, right? I was raised extremely conservative. My parents are very, very conservative, and me having an EMS background and a little bit of background in medicine, a very small background in medicine, comparatively speaking, I had to balance those 2 things and balance those 2 thoughts, because there was a lot of information that was getting out, I feel, that necessarily wasn't 100% true, right? And that was on both sides of the equation. And so it really played a hard role for me making decisions regarding it. I had to approach it from basically what the show's title is, from a civility standpoint. That's how I made all my decisions regarding public health and the public health district. And I'll most likely continue to make my decisions based on that, on that level of civility. There has to be a break. And I know everybody's heard me say it, it goes beyond politics when it comes to public health and health concerns and issues like that. You kind of have to take your mind out of the politics a little bit and do what's right for everybody. And so it kind of made it really hard to make that decision because I had a lot of folks, of course, in my region who wanted nothing to do with it. It was a pandemic, so on and so forth. And so I feel like I had that on my side, trying to figure that part out and try to balance that with my constituents. And then also trying to balance what I already knew, being a medical professional and having that experience in dealing with folks who are sick and spreading disease and illness and stuff like that. So it really was a hard spot for me. I had to compromise in a lot of areas, and it was a real gut check for me personally. So it was just a very different situation to be put into.
Yes, thank you very much for that, Commissioner. And Dr. Epperly, your involvement with the Public Health Board predates COVID-19 by many years, whereas Commissioner Sturm joined through his role as a commissioner. Can you give us a history of the board's COVID-19 response and some of the tough decisions that you had to make?
Sure, absolutely. Thanks for the question, Luke. First, I just want to pick up on a point that Diana made earlier. It's so true. For the most part, all the work of the public health department is behind the scenes. When public health is going well, nobody notices it. And that's the way it should be. People are healthy, communities are healthy. What COVID-19 did was took us out of that and put all of us into the spotlight. As Ryan well said, none of us were planning on that. But we were kind of thrust into the position of both accountability and responsibility. I think that what I would add is that we very much as a board tried to approach this as respectfully as we could with each other. We recognize, just like with any group of people, there's going to be multiple ways of looking at things, and we needed to try to find a balance. And Ryan, I think you said that really well. We both were well aware of opinions that wildly raged on both sides of these issues, and we're trying to find the best path forward for the community. My personal approach was to read a lot, to try to stay knowledgeable to the best of my ability, to listen a lot, because I recognize that there was a lot of thought on this, and one of the most important things is we do keep a bit of an open mind and try to do the right thing at the end of the day, and then try to contribute to the board in a way that helps the group of board members, of which there are 7 of us, make the best possible decision. What I did in particular, or a little bit of the history of COVID-19 and the tough decisions, Luke, to your question, was initially, as many may remember, what we did as a Board of Health is we followed the governor's lead. Governor Little, very appropriately, I think, took charge of this initially in terms of getting the state on the same wavelength, tried to get everybody both aware of the problem in terms of education and communication, but also in terms of trying to prevent the spread of the illness. And so took a lot of very active steps in that first month or so of the pandemic. What Governor Little and his team then did, though, heading into months 2 and 3 and 4 of the pandemic, is transferred the responsibility over to the public health departments. For me, that became what I saw as a bit of a mistake. Because what happened by doing that, instead of having a centralized plan that could be applied thoughtfully to all of the state, it became very factionalized into the 7 public health districts. And by doing so as well, since most of the board members of our 7 districts of public health are county commissioners, it suddenly thrust a public health crisis, a public health emergency, into being a very political situation. And so instead of trying to act thoughtfully around what was the data and evidence around public health, we started to react more about what political camp we were in regards to our approach to it. And again, I say that respectfully. It was just part of the problem of decentralizing the plan to the pandemic. Not trying to be critical, just pointing out from my perspective what I saw happen. What we did in Central District Health, of which Ryan and I and Diana were all parts of then, is we tried to deal with this the best we could at our district health department. We followed Boise Mayor's lead in regards to really taking a pretty active stance around public health initiatives. Those 3 major initiatives are masking, social distancing, group size limitation. And this is where the controversy all started. As we took more active public health intervention steps, which started to have an effect on people's perceived liberties and freedoms by such things as group size limitations, potential closures of businesses, all with good intent to try to help prevent the spread of the virus, it started to become a major problem. The camps only worsened in terms of which side of this equation were you on. And so that was some of both the history of COVID-19, how we got to where we were, how did Central District Health become so central to the decision-making process in this, and some of the tough decisions that we had to make. I'll just end with this one thought, and that is, as we increase the level of activity around increasing public health efforts, the public as a whole started to become more and more frustrated with this. There was quite a bit of protesting. I know we'll get to some of the issues around the protesting, and we kind of factionalized into camps. There was a camp of people in our 4-county area that very much thought that was appropriate and needed to be done. And there was a camp of people who very much did not believe that should be done. And so I'll just leave that question right there, Luke, for the time being. But that's kind of some of the history of this.
I'm going to follow up on that, though, because I think it's a really good time to ask. So knowing what you know now, in retrospect, what do you think that the health district did well and what could have been improved on in the response?
Yeah, and Luke, you're asking me that, or Ryan?
I'm asking you that, Dr. Epperly.
Oh, okay. I think we probably could have communicated better and educated better as to the why, in terms of trying to help people understand this, that it wasn't a political decision being made. It was a public health decision being made. Ryan well addressed this earlier, that what we weren't trying to do is play politics, but I recognize that it got branded as that. And I would just say that from at least my perspective, because I've voted equal number of times Republican as I have Democrat for governor and president, I'm kind of a real centrist sort of guy. This wasn't a political issue for me. This was a public health issue for me. But I think we could have done a better job with both the communication, the education around why, and I think that would have perhaps helped more. But I'm not sure, maybe just this one last thought on this, I'm not sure it may have, now that I reflect, now that we've had kind of 5 months to reflect on this, because the nation had become really polarized on this right from the get-go. And we kind of broke into factions and camps even before Central District Health became responsible for handling this. And so it was almost a perfect storm, if you will, for now having a group of elected and non-elected people, all with the intent of trying to do the best we could for the community, being thrust into a very political arena with a public health crisis on our hands.
Well, thank you for that. And from an outsider's perspective, I'm the only outsider on the panel. It did look as though you guys were set up not to be successful because of the circumstances to begin with. So I appreciate all your work into that and appreciate your response on that. And Commissioner Sturm, we got an interesting question on from Facebook, and it kind of ties into the next question I was going to ask you anyway. What are some of the misconceptions, issues, or political problems you came across from both sides? And you're a paramedic, and you're very attuned to what was happening with the realities of the pandemic, I assume. So it's interesting to me that you voted against a mask mandate in Boise County. So maybe you can kind of just talk about what the political realities were and some of the misconceptions, the issues, and then why you ultimately made that decision.
Certainly, Luke. So being an EMS, of course, I've seen folks with COVID-19. I've treated them. I've seen them, taken them to the hospital. And the one thing that I've gotten out of that a lot is, man, if I would have known it was this bad, I would have probably went and got the vaccine, or I would have done this, or I would have done that, right? And so, now, granted, everyone, I am all for health freedom, right? But I'm for health freedom when it affects you and not me, right? So when your health freedom starts affecting other people, then that's kind of where I have to start questioning things, right? And COVID-19 did exactly that. And so when it came to my decision-making process, I feel like, because I'm a county commissioner and that's my number one priority and my number one job is to serve the citizens, right? I wasn't necessarily in my scenario, was not elected to this position. I hope to be elected when my time comes up, when I run for office in 2022, but I was appointed to this position. And when I was appointed to this position, I took a certain set of steps when I made comments in my interview. And so, being a first-time politician, one of the things that I had to learn really quick was you work for the people, right? So what I've explained to a lot of folks is the reason for my switch in stance was not because of my personal feelings, but when it came time and the day came for us to make a mask mandate at the beginning of the pandemic, when Ada County was experiencing the biggest problem and the most cases and the most deaths and the most issues, those folks were emailing, and Diana and Ted can both attest to this. They were emailing us madly, please do it. Please do it. Save my family, save my baby, save my life, whatever the case may be, right? Everyone had their own story. And as time went on, I believe anyways, the fear and the overall concern in the younger generation started to go away. It was still there with some of the older folks, but it started to go away, right? And so one of the things that changed for me was my folks, my constituents and my people said from the beginning, we absolutely do not want a mask mandate, business closures of any kind whatsoever. We 100% oppose it. And I received more emails from my own county constituents regarding that than I did from the Ada County constituents that wanted it when their time, when the question was on the table for them. And so, being a public servant, that's where I was talking to Dr. Epperly about it, and he mentioned it, when I said I had to kind of split hairs there, right, and figure out what was going to be the best. And did I necessarily feel personally the 100% that was the best decision? No, I did not. I know that Boise County fared very well, and from a political standpoint and from a all-inclusive standpoint, as far as how things turned out, looking back, like Dr. Eppley said, 5 months to reflect, right? It worked out great, and marginally did not have that many issues up here, in the mountains, so to speak. So I think just because of geographically the nature of our county, we're spread out people. We don't deal a lot with each other anyways. We're not a real close community as far as physically close, right? We don't spend a lot of time together, congregated in stores and restaurants. Most folks up here, including myself, I don't go to Ada County unless I have to. Sorry, Diana, but I just don't. I don't go to Ada County unless I have to, and that's generally for groceries, and that's about it. Everything else comes from Amazon, right? The guy knows my address pretty well, and that's actually talking to a lot of my constituents. They run the same way, right? It was very easy for them to go, oh, well, Ada County's got a mask mandate, and I don't want that, and I don't need anything from there, so I'm just not going to go. And that was probably the biggest struggle that I think Central District Health had. And when we go back to, like Dr. Epperly said, where the state government kind of, I think, failed us to some extent, was you have the largest metropolitan area in the state next to the smallest. So at the end of the day, when you have one of the smallest areas and the largest geographical area, but the smallest community, right next to the most metropolitan area there is in the entire state, that crossbreeds a lot of problems, both financially and economically and everything else, right? So one of those issues is you have a situation where what's good for Ada County doesn't necessarily do good for Elmore or Boise or Valley County, right? And so, but the side effect of that is a very large portion of the residents of Ada County visit those other three counties on a regular basis for recreation, right? And where they have homes there, or second homes there, cabins, or whatever the case may be, right? So you end up in this situation where you're trying to make a decision for your people and your constituents and to do the right thing by the people that have you appointed. But at the same time, you realize that there's a level of cross-contamination there, right? So that was kind of where I was coming from, was trying to balance both of those situations and ultimately make a good, solid decision for both sides. Something that worked well for Ada County, I realized was not going to work in Boise County. And that's unfortunately the nature of the business that we're in, right? Being in politics, that's the nature of the business that I'm in, is what's going to work well in Washington, D.C. isn't going to work in Idaho. And so I have to think of that, and I had to put effort into that. And so certainly I think that, echoing Ted's statement, I do, not criticizing, but I do think that the governor absolutely should have kept control of this and made it a unified decision on his end. I think that would have ultimately been the better move, just from a unified approach, right? And of course, it would have made a lot of us a little bit happier because we would have had a little bit taken off of our plates, but that's not how it panned out.
Well, I think most of that came through, Ryan. We did get a little bit of buzzing. And to your point, you guys are more spread out up there in Boise County. So we know you struggle sometimes with the internet, but I just want to I want to kind of insert myself a little bit into to follow up on that point, because I'm sure you guys got sick of me calling out the numbers in our Ada County hospitals from other counties. And that was what I was really paying attention to, was what was coming over from Canyon County, because they didn't have a mask mandate, and yet their residents were filling up our hospitals and potentially compromising levels of care. So that's, all of this sort of played out all together. So, following on that, Dr. Epperly, like my family, you were on the receiving end of protesters outside your private residence. That was, for me, unfortunately, my, 15 minutes of fame. But with COVID-19 becoming such a political issue, I want to know, both during that time, but also now, as we're headed into this different phase, How are you balancing, your very real medical knowledge, acquired over many, many years, with the conjectures of those who are doing their own research on the internet? How are you handling that? Because it's obviously very dicey.
Yeah, great question, Diana. First, I just want to echo two of Ryan's points. They're so well said, Ryan. One is that one size doesn't fit all approach can be problematic. And the Ada County, Boise County differential there is perfect. And we were trying to find balance in approach with this. So I just want to really make that point, because part of the strength of your program in civility, in search of civility, is where are the common denominators? What do we agree with? And I certainly agree with that. It was one of the contrasts to all of this, which is probably in part why Governor Little probably wanted to have this go to each of the public health districts. But what wasn't anticipated, as I'd mentioned earlier, was then just how potentially divisive and political it got. And I think that
Looks like we temporarily lost Dr. Epperly there. And so
Yeah.
Diana,
I'm back.
okay.
Sorry, guys. It's internet instability happens here in Ada County too, I'll tell you. So I'm sorry. I don't know how much of what I said you got, but I was watching for it. So I think we're on track. I did want to mention that to your question, Diana, around the protests and trying to balance knowledge and research. What I have come to observe is that, again, the way knowledge was acquired during the pandemic did differ amongst groups of people. And maybe that's part of why we were so challenged with this was social media and news sources, news feeds have really advanced quite a bit over the last decade. And so people were tuning in to their news source of preference. And of course, the way the internet works and the way Facebook works and a lot of news media sources is it's an algorithm-based approach. So the sorts of things that you were selectively listening to got amplified during the pandemic. And if you were listening to some news sources that were dealing with the pandemic in one way, then you got that amplified through your news feeds. If you were listening to how the pandemic was being responded to by another alternative source of information, that got amplified. So what I saw happen was there was a growing divide of how the information was being sorted out to people. And I think that's really an important point. In search of civility should be that we try to keep an open mind and try to understand the best we can other people's points of view and be respectful about that. I think we can differ in opinion, but if we can do it respectfully and trying to understand and educate, I think that's best. I just wanted to say in terms of the protests, and Ryan and I share a lot of similarities in our bios. We both served time in the United States Army. We both work in healthcare. We both are born and raised in Idaho. So here we have two Idaho young men, maybe more middle-aged to older men and me, trying to deal with our fellow citizens. And what I saw happen with the protests, I was shocked at. I was dismayed with, because that's not the Idaho I've come to grow up with and to know. Yes, we can differ in opinion, but I think Idaho, in my characterization, has always been a pretty respectful state of trying to understand differences. But I saw this being much more than that, much more polarized than that. And again, I don't know if there was, again, I've mentioned the news feeds and the polarization through social media and the internet. Certainly, this was polarized right from the get-go at the national level in many ways. I don't know if there was outside agitation as well that helped stir up our people. I think in part, yes, that probably happened. Perhaps with time, we'll sort out some of that more. But it seemed to take on a bigger life of its own than I had recognized. And I'll stop with that. I think that perhaps I've answered your question, I hope, Diana, in terms of that. But those are some of my observations around your question.
So thank you, Dr. Epperly. And I want to pick up on that for you, Commissioner Sturm, because you made some reference to it. You know, you're taking care of patients, you know, potentially taking them to the hospital. And I want to understand both how you responded to people sharing misinformation about COVID and now with the vaccine. How are you handling those concerns? Because I guess what I'm trying to get across here, people do have very real concerns, maybe because of where they're getting their information. So how do you respectfully handle those concerns while as a medical professional and as a county commissioner sharing what you know to be correct information?
Certainly, Diana. So for me, I've been vaccinated. I don't know if we had a chance to share that with each other or not, but I've been vaccinated. So I got vaccinated back in February. I caught a lot of heat about it, but I can say it works. I've been in the back of an ambulance without a mask on with a known COVID patient, and I still have never had COVID. So I guess there's no better way to test a vaccine than that. Human testing, I guess, works the best, right? For me, it's hard because, like Dr. Epperly said, we are the most informed age there's been. For example, if I wanted to know how to do heart surgery in a pinch, if I got the internet, I can watch a video on it. I might not do it right, but I can watch a video on it and I can work my way through it, right? Probably not what somebody wants, but ultimately now, depending on my personality, I can look at you and say, well, I'm a heart surgeon. I just did heart surgery. I just did heart surgery on somebody because I watched it on the internet. And I think that the unfortunate side effect of that is that you're not going to change somebody's mind necessarily who is being fed a stream of false information. You have to kind of agree to disagree and understand that the information that they're getting is, even though it's not true, it's true to them. And I think you kind of have to approach folks that are in that situation with a little bit of understanding that you don't know more than they do. You're not better than them. You don't know any more than they do. You're not smarter than them. But we got information straight from doctors, leaders of hospitals, people who are living this lifestyle every day versus, getting information from my brother's cousin's nephew or, my uncle or my cousin or whatever, depending on where they live, right? And what they're seeing and what they're dealing with, right? Because if you got information from someone that was living in Portland at the time of the pandemic versus someone that was living in Kamei, Idaho, that opinion and that conversation would be 100% different. And no, those two people would not agree. Regardless of what their political beliefs were, those two people would not agree on a base level because they have two different experiences of the pandemic altogether. There are people out there that were literally touched at zero by this pandemic, maybe didn't even know what was going on, or just thought it was just a flu that was passing through. And then there's people whose lives were changed forever, lost their majority of their elderly family because of it. And so at the end of the day, I think that when you approach those questions and you approach having a conversation with people regarding the pandemic and whether or not mask mandates work and those kinds of things, you have to take in, part of that civility is taking in the fact that they're informed to some extent, right, wrong, or indifferent. And back when the Spanish flu came in, no one knew. They didn't have any information but what the government gave them, right? They didn't have any information except for what their local doctor was giving them. And now I can Google anything, literally anything. And I have the entirety of the world's information on my phone. And for some people, that makes them an expert, period. No doubt about it. There are folks out there that have a very alpha personality, and it instantly makes them an expert because they read it on the internet from whoever their trusted source is. And so people that are in that situation, you will never be able to convince otherwise. I firmly believe that they're going to be stubborn in their thought process, and you just kind of have to let them come to their own realization. And that, working in EMS, seeing folks in the back of the ambulance, I have treated a few of those folks that have that mentality prior to entering the back of my ambulance. They did not have that mentality when they got to the hospital. And so, God is the ultimate equalizer in everything. So at the end of the day, whether you like it or not, there was a lot of moving pieces with the COVID-19 pandemic, and the politicization of the whole thing was probably the biggest moving piece that could have taken place to jeopardize the efforts of anyone trying to just do right by people in general. And that's unfortunate because I believe there are portions of the world in general that suffered from that politicization of this illness. And because of that, there was probably more unnecessary illness than there needed to be. It's unfortunate, but I believe that to be 100% true. And I also believe people took advantage of the fact that COVID-19 happened, and they took an opportunity to capitalize on that fact. And that's, I think if you look deep into everything, you'll find that on both sides.
Yeah. Thank you very much for that. And that really ties into really well to the whole reason that we're doing this. And Dr. Epperly, you mentioned this as well. So thank you to both of you. The reason that we have In Search of Civility is so that we could talk a bit about or really focus on how civility impacts our lives. And one of the ways that we talk about that is how it impacts public service. Public service, particularly at the local level, is the hallmark of American democracy. Yet with this increased polarization and the incivility that comes along with that polarization, there's a lot of worries. And amongst those of us who do this show, including Diana, Matt, and Kelly and I, we worry that fewer people will stick their neck out for appointed, let alone elected positions. How do we encourage more qualified, community-minded people to participate in something like the health board? And I'd love to hear both of your takes on this. You mentioned that a little bit earlier, Commissioner, but Dr. Epperly, what's your answer on that?
Yeah, it's a fantastic question. Very important. A couple thoughts. This too shall pass. We will heal from this. The question will become, do we learn from this? Learn some of the lessons, because some of the lessons are what we're talking about now. And that is, how do we differ with different opinions and try to help educate and move people forward, role model for them? I think if we, in particular with children who live through this pandemic, and there are a lot of them out there, if we can help them understand with conversations that it's okay for people to disagree. We should do it respectfully and civilly. Let's try to be a better population with understanding and being tolerant to different views, and help role model that for them, communicate with them, educate them. I think we'll get through this just fine, and we will heal from this. I think right now, Luke, to your question, there'd be a lot of people who say, I'm done. I'm not running. I'm not doing this kind of stuff because it's too painful. But at the end of the day, to your question, we've got to have people who care about the public, that do step forward, that do want to help be leaders in our communities. So those are some of my thoughts with this. I think if we could do this sort of discussion in schools, this would be fantastic for debriefing a lot of second, third, and fourth graders out there who saw all of this play out, and potentially through the
We have Boise County and Ada County debating to see who has the worst internet. And while we're waiting for them to
Sorry, guys.
you're back. Okay, good.
I froze up again. I'm sorry. I was just concluding a thought that if we could have this discussion, I think, and help them understand and see the open-mindedness, the civility of this, the respect of a different thought and how we handle it as adults, I think that could be very helpful. And Luke, I'll end with that because I know Ryan's got some probably great comments as well.
Unfortunately, I think we've lost Ryan. Oh, looks like he's coming back. Ryan, can you hear us?
Yes, I can hear you. Sorry about that.
No, it's okay. It's okay.
Internet.
It's contagious, Ryan. I'm having difficulties as well.
Well, in case you didn't hear, Luke Malek is running for lieutenant governor, and I told him his #1 platform needs to be better broadband. So we'll make sure he comes through on that.
Right. Right. Well, we actually just got a CARES Act public broadband grant for Lowman, so they can get broadband up in Lowman. So I'm 100% for it. I can tell you, if Luke, if you could real quick repeat the question real quick.
Yeah, absolutely.
Internet and
let me do that because I think that it ties well. We have a commenter on here who's asking the same question, and it's actually it's an answer to the concern that we have. The concern that we have is with it becoming more polarized. How are we going to get people involved? And then a commenter, Kalisha, says, speaking of getting more quality community levers in the trenches of public service with you, where do you suggest someone start out? So maybe you can answer both my question and her question. How are we?
Yeah, absolutely. Yeah. So, I started out, just to kind of give you a quick background on me. I started out at the city council level. I was asked by one of the city employees to run. They had an incumbent in there that had been there for a while, and they wanted to see some change. And for whatever reason, they felt that I would be a good fit for that position. And so I ran. And I won. I think my incumbent only got like 25 votes, and I got the rest. And so that's where I got started. I think to the point of everybody saying, hey, it's just, why would you want to get involved? How do you get involved? And so on and so forth. For me, it was COVID-19 was a very gun-shy moment for me. I wanted to leave politics very badly at that point. While it was going on, I know me and Diana had a lot of conversations about politics in general during the whole COVID-19 situation. And we, I struggled a lot of days staying in politics just because I kept racking my brain going, why are people so against just taking care of themselves? And it really took a toll on my conscience, because I was just trying to be a good person, right? I wasn't trying to ruin anybody's life. I wasn't trying to take anything away from anybody. I just wanted everybody to be safe and healthy so that they could go home at night and live with their families. And that's where my heart was when I was making the decisions I was making. But I think that, with the COVID-19 pandemic, we saw what politicians faced based on the decision that they made. And we're still seeing that. Oddly enough, I saw a Facebook post today that was actually a copy of a comment that you had made, Mr. Malek. And so I kind of giggled about it. I was like, can't even make a comment of your own without being just hammered for nothing, right? Just making a reasonable comment on something that's completely an unreasonable topic. And so I see a lot of that. And so unfortunately, I feel like with that kind of anger and frustration going on in the political world amongst politicians, that makes it really hard for people to want to get involved, because let's be honest, nobody's getting rich at the local level being a politician at the local level. Nobody's going to make it's enough to make a living off of, but no one's going to be a millionaire. I would like to say that if you want to get involved, start with a community-based action program like YCAP or any, that you don't have to be an elected official to be on any of the health boards. So absolutely get involved at the local level. Get involved with YCAP, the food bank, any of those, local organizations, and you'll start meeting the politicians. And when you start meeting the politicians, then you can start seeing what everything is about. And then, PTA, school board. My wife was a member of the school board there in Horseshoe Bend for a while. That's the easy one to start with, school board. Local school boards are always looking for volunteers. That's where I would start, because then you get a good idea of education and the education system, and you can start helping make a difference at the beginning level, where the kids start.
Well, Luke's gonna wrap us up here and thank our sponsors, but before he does, I want to just give a special thank you to our two guests, to Commissioner Sturm and Dr. Epperly. Public service is hard. Everybody involved with this show has been through it. But my experience working with both of you is that you really do have that true servant's heart. And I'm going to get kind of choked up thinking about it. As I said, we all need to go have a beer together, because while I wasn't in the Army with you, I feel like we went through a war. So kudos to both of you. Thanks for all that you do every day to keep our communities healthy, and really for your heart and service for the people of Idaho.
And I echo that. Thank you both for your service and for coming on the show today. I think it was very helpful for our listeners, and appreciate our listeners tuning in. Sorry for the technical difficulties, but as Diana said, we could always use more support in getting more broadband out to our rural areas. So with that, I do want to say to Kalisha, thank you for your question. And I'm sure that anyone on this show today would be happy to hear from you if you're looking to get more involved. We'd also like to thank our partners, the Association of Idaho Cities, Smith Malek Attorneys, and the Boise Metro Chamber. Thanks to our media partners, Idaho Ed News, the Idaho Statesman, and the Idaho Press, and our incredible presenting sponsors, Dawson Taylor Coffee Roasters and the Idaho Central Credit Union. Additionally, thanks to our sponsors, Power Engineers and Ørsted Architects. Thank you all for making this possible. We'll be back next month with another edition of In Search of Civility, this time in partnership with the City Club of Boise on August 25th. So stay tuned for details on that, and we look forward to seeing you then. Thank you so much.
Thanks, everyone. Stay well.